going to demonstrate the common places where blood is drawn or drips are put up, particularly over the wrist more so than the hand. Clean the area that you are desirous of using with an alcohol swab or with warm soapy water. Make sure it's completely dry, otherwise your plastic will not stick. Now, use the cream, open it by turning the cap round and perforating the opening, putting a pea-sized blob of cream over the wrist. You can particularly see that there are green-blue colored veins. That's what you're aiming for. Then we put a transparent plastic dressing over the top. The idea of this technique of placing it is to avoid your fingers getting stuck to it, which is super sticky and can quickly become stuck to your fingers. You then pull off the grid-like rigid plastic covering and you're left with a transparent thin plastic which is totally flexible. That white blob of cream will become translucent over the next 15 or 20 minutes. You may have been offered an EMLA patch. The skin preparation is similar. You tear off the foil portion of the patch, placing the patch directly over the wrist area. However, this patch does not stick as well as the previous transparent plastic and may need additional support. In the older child or adult, veins in the inside of the elbow are often better places to apply EMLA cream. A blob of cream underneath the transparent patch works exactly the same as on the wrist, but in half the time. It may be possible to numb up a vein here within 15 to 20 minutes, where time is a factor. Once again, place the transparent dressing over the cream, take off the rigid covering, and leave until it goes translucent. Notice the flexibility of the plastic. In review, the challenge is making sure you use the transparent dressing properly. First, remove it from its outer sheath. You'll notice that it has two white leaves which separate in the center. Pull one of the leaves, the shorter one, off, turn the patch over so the sticky side is down, and stick that to the skin. Then pull the rest of the leaf off, placing your hand over the entire patch to stick it down. The outer rigid covering is removed and the patch is left on for long enough for the cream to become see-through, as you see here.